Hi viewers, welcome. This is your host Dr. Roslyn Odhiambo on Skills versus the Midwife, and today we would like to discuss about the maternal pelvis, and we are going to look at its importance in midwifery and obstetrics so that you can be able to appreciate what role it has when it comes to childbirth and delivery. So for starters, why is it important for us to actually learn about the pelvis? And as you can see, I'm holding a pelvis here. All of us have pelvises, whether male or female, we all have pelvises, and this is how the structure actually looks like. So it's important for us to understand actually the anatomical challenges and variations, and even the changes that occur during childbirth when you talk about the maternal pelvis. And we will be able to understand that the fetus can only pass through. Remember, the fetus is the passenger and the pelvis is the passage. So what is the function of the pelvis? Number one is that it is adapted for childbirth. And when you look at the different types of pelvises which we have, the gynecoid pelvis is the one that is actually suitably adapted for childbirth. Then, of course, number two, because the pelvis is at a point where it's able to support most of the body structures that are above it, so it bears the weight. That is why it's possible for us to walk, to sit, to run, and even to squat, do some of those physical activities. And number three, it protects the pelvic organs, including the reproductive organs. So this is where we find most of the reproductive organs, and it protects all of them. It also supports the spinal column and the vertebral column. Look at this. So it supports all that all the way, and it gives it some good anchorage. All right. So having understood the function of the pelvis, let's now look at other aspects of the pelvis, and we'll start by talking about the bones. Also, what bones make up the pelvic bone in a nutshell. So let's look at this. So the pelvic bone is made up of two innominate bones. Look at this. This is one innominate bone. This is the other innominate bone. All right. It is also made up of the sacrum. The rear view, this is the sacrum. The front view, this is the sacrum. And it is also made up of the coccyx. Look at that. So where the sacrum ends, we have the coccyx. I'll come again. So what makes up the pelvic bone? It is made up of two innominate bones. It is made up of the sacrum, and it is made up of the coccyx. Now, this innominate bone is also having quite a number of parts in it, and the innominate bone is made up of ilium. Are you seeing this flared out part? This is the ilium. It is also made up of the ischium, this bottom part that will give us some kind of anchorage when we are sitting down. So this sharp pointed part, this area is the ischium, and it is also made up of the pubis. So what makes up the innominate bone is the ilium, the ischium, and the pubis. Just to recap that, what makes up the pelvic bone as a whole? It is made up of two innominate bones, sacrum, and the coccyx. What makes up the innominate bone? Ilium, ischium, and the pubis. Apart from understanding the bones that actually make up the pelvic bone, we need to discuss other parts of the pelvic bone that are also essential. Now, let's start from the sacrum. The topmost part of the sacrum is what we call the sacral promontory. Now, normally during childbirth, when we are doing a vaginal examination, we don't expect to tip this area, because if you tip it, it simply means that the shape of that that sacrum is not normal, and that can actually interfere with the diameters when we are measuring and we want to assess if the pelvic brim is adequate for the fetus to actually pass. Then we have other parts. Look at the sides of the sacrum. We have this flared out part. This is what we call the ala wing. All right, the ala or the sacral wing. All right, and then on the ilium, this top part is called the iliac crest. And then we have the iliac spine at this end, and for the iliac spine we have the anterior and the posterior iliac spine. So on the topmost part we have the anterior superior iliac spine, and on the rear we have the posterior superior iliac spine. On the lower part of the ilium we have the anterior inferior iliac spine, and on the rear we have the posterior inferior iliac spine. All right, so this is the iliac spine, and then this is the iliac crest, and then inside here, the concave part that you are looking at here is what we call the iliac fossa. This area here is what we call the iliopectineal line that ends up in a section we call the iliopectineal eminence. All right, and then when you come down, we say this is the ischium, and this protruded area is what we call the ischial tuberosity. This open part is what we call the obturator foramen, and the obturator foramen is essential in the sense that it allows the obturator nerves and blood vessels to actually exit the pelvic cavity and supply the thighs. Okay, so this is the obturator foramen, and we have just close to it we have the acetabulum. So the acetabulum is the place where we have articulation of the femur. All right, the femur bone is the one that is found on the thigh, so this is where the femur articulates in. And then down here we have the ischial ramus, and as we come just slightly in front on this other direction, this is a joint which we are going to discuss in a few. Then when you look at well, let me turn the pelvis upside down a little bit. Look at the sharp pointed areas on the left and on the right side. Okay, on the left and on the right side, here and here. So this is the ischial spine. Ischial spine should not be pointed because they can cause injury to the fetus as it is passing out. Okay, and we have some pelvises that have sharp pointed ischial spine, so those are not favorable for childbirth. You can continue looking at the anatomy quite a little bit more so that you can grasp the concepts, but like I said, all these parts are essential for obstetrics. They are essential for midwifery. There are some like conditions like cephalopelvic disproportion, whereby the diameters of the fetal skull don't match diameters of the pelvis, and at the end of the day the fetus doesn't come out. So it's good to understand the bone. Like when you look at the brim, it is rounded, so we are going to look at the diameters also as we continue. Join in the next session when we will be discussing on the pelvic joints. Thank you, and see you in the next video.